Hi, it's Chris Sovey, Doctor of Physical Therapy, and in this video I'd like to share with you two exercises that we commonly give almost all our patients with hip or low back pain, because we find that more than 90% of them are weak in these muscles. And all you're going to need for this is a balloon and a firm surface. So I am going to jump right into it in just a moment here. Bear with me. If you want to skip ahead, you can check out the timestamps. But I did want to mention that think about the basic anatomy of the hip. Nothing too crazy, but think about the hip as a ball and socket joint. So you have the thigh coming up, and then as the neck and the head, the ball goes into the socket, it's surrounded on all sides by different muscles, and then it's also influenced by your lower abdominals. You hear the words like the core, but really the core is a lot of different muscles that we won't get into today. The good news is you don't have to know that, you just have to know how to activate some of those muscles. And one of the easiest ways is actually blowing up a balloon to get started. And then we're going to build on that on one more exercise after that. So check this out. So you're going to lie down on your back, and you're going to take your balloon. Of course, you don't want to do this if you're allergic to latex. And always talk to your healthcare provider first. So you're going to take your balloon, stretch it out a few times. And then we just want to find a comfortable, relaxed position. The back shouldn't be too flat or too arched. Just relax. Legs bent and relaxed. And then we're going to breathe in through the nose, into the belly, and then out through the mouth. And you're really going to try and blow up that balloon as much as you can. Now I was talking, so I probably could have done a little better there. But we also want to make sure that our pelvis and our back doesn't flatten out while we do that. Everything else stays there. You're just pushing the air out using those abdominal muscles. And then you're going to work your way up with the endurance of that. See if you can get some more air. See if you can work up to about 10 repetitions. Pardon me while I deflate this balloon. So you're going to take that concept and you're going to take it into a bridge exercise. We're going to have our hands by our sides, and then we're going to breathe in, and then just like we're blowing out through the balloon, we're going to lengthen out through those knees. And we're going to get a straight line as much as we can, all the way from the knees up to the shoulders. Why are we doing this? Almost everyone is weak in their glutes. I've never seen anyone overtrain their glutes. This is a great starting point. If you absolutely can't tolerate it, you might start with just squeezing the glutes together and work your way up to this. If you get cramps down your leg when you do this, you're probably gripping or you're arching your back. You can just flatten out slightly. Even though you're feeling that down your thigh, it's coming from your low back. So we want to breathe and then breathe out. As you get a little stronger, you can try lifting a heel, alternating heel lifts, like that, trying to keep everything straight as if you had fine china on your stomach and you're trying not to let it fall off one side or the other. And then we lower back down. You can even work your way up into like a full foot lift, like that. Little marches. You can go mummy arms, like that. You can even work into a kick out as you get stronger, little bit by little bit. Always turn to your side if you have hip or back pain especially, and then come up from there. So that's a great starting point, but there are many other progressions to that, but I highly encourage people to try those and see if you feel even 5 to 10% better. If you got value out of this, be sure to drop this video a like. It really helps us with the YouTube algorithm. Subscribe to the channel if you're new. And if you enjoyed this video, check out some of the other videos on our channel too. We post all the time about hip and low back pain. I hope you found value in this video, and this is Chris Sovey from Healthy Consumer Physical Therapy.